It's time for Top Story on AM 1480 WLEA Hornell. Here's Brian O'Neill.
Well, the week started out as a crazy day for the stock market. Tuesday was not a whole lot better. The state teachers union this week and the state attorney general's office, Eric Schneiderman's office, are trying to get the Campbell Brown lawsuit dismissed. Campbell Brown, the former CNN personality, is suing New York State to have the teacher tenure rules changed. The Hornell School Board approved the final school taxes for the school year, and an accident on Route 248 with some Canisteo Greenwood students injured. None of the injuries were life-threatening. And there was a town hall meeting of St. James Hospital officials. That's our show today. We're going to take audio highlights from the St. James Town Hall meeting, starting out now with Hornell Mayor Sean Hogan.
I'm happy to report that, we had signs all over town there that said, save our hospital. I think tonight you'll learn that those signs can come down and be replaced with support our hospital. I think so many people have done so many great things, and we've had so many people working together to ensure that a quality health care delivery system in this community would continue today and into the future. There's been a lot of people from the board of directors, the administration, and you'll hear from some our partners from the University of Rochester who have come down here and boots on the ground and helping turn this institution around.
Mayor Hogan spoke highly of Dr. Raymond Machevsky.
Dr. Ray Machevsky, who is the chief medical officer at Highland and Strong. He also is a practicing physician. So he's here now as acting chief medical officer for St. James. He doesn't have enough to do you, Ray? Yeah, but he's here. He's been very instrumental and very supportive, and the medical staff is rallied around Ray, and he's rallied around them, and things are moving in a very positive direction.
Dr. Machevsky says some interesting things. We'll hear from him on today's show and what he said at the St. James Town Hall. Getting back to Mayor Hogan's part of the talk, this is the mayor introducing St. James CEO Jen Sullivan.
A young woman who has worked tirelessly on behalf of this community and this institution. And I know sometimes she has to, in the leadership position, you get the slings and arrows and you have targets on your back, but don't think for 1 minute that your efforts have not been appreciated. And having been in the political arena for over 30 years, I know people don't always agree, but it's important that we come together and support this hospital. And I'm sure you'll find the future of St. James is bright. There's a lot of work to do, and it will be done. And without further ado, I will introduce Jen Sullivan.
Hospital CEO Jen Sullivan started out by talking about the different people in the crowd, and she introduced them. The part we're going to start off with is Jen Sullivan giving an overview of the transition period for the hospital.
So here's what's happened in the last 8 months since we last met. The first one is we did successfully separate from Trinity at the end of April, and you might say, well, what does that mean? And really the long and short of it, that means that allowed us to start with a fresh start. Clean our balance sheet, we had no more debt, they took care of all of that. That was over almost $20 million. So many organizations don't have the ability to start fresh with a clean slate and just get rid of the debt from the past. So that happened there. We became independent on May 1st. And then towards the end of May, early June, we introduced university and nursing and medical staff leadership to the team. And they've been with us on an interim basis. We had a CMO and a chief nursing officer with us They had agreed to be here for a couple years through our transition, but they made really long commutes for 2 years and had said, you know, we'll stay with you through the transition, but we really want to go home eventually. So we're very thankful to the University of Rochester Medical Center for providing us interim leadership as we transition going forward. We did sign a letter of intent with the University of Rochester to explore an affiliation, and that happened in June. So we continue moving forward. We also received a Rural Healthcare Access Grant to expand our emergency services. Very good news. We've done a lot of recruiting providers. We did add a new provider for behavioral health services to the team. We signed an administrative agreement with the university, so they've been on site weekly helping us with nursing, our transformation plan, collaborating with New York State, helping us with Joint Commission preparedness. And their team, they have departments that are probably as big as our hospital, and so they can help us with construction management and things like that as it relates to our new facility. And then a new pathologist joined our team in June, Dr. Pecos, and she's here with us as well.
At one point, Jen Sullivan talked about all the medical services that are still around.
So when you think about what can you get at St. James, what could you get here before we separated from Trinity, and what can you get here now? And the intent of this slide is to show you that almost all of the X's are still there. So, you know, maternity is the one that we do not have today. I know it was very sad for us and it's still hard, but that being said, we were able to preserve most of the list that you see here, and all the X's are there. We're still open, we're still providing services.
You're listening to Top Story on AM 1480 WLEA. What we're doing today is playing highlights from the town hall that St. James had the other night. Here is Jen Sullivan, the hospital CEO, once again, and she's talking about the nursing jobs at St. James.
In terms of recruiting nurses, we did see a lot of transition of nursing staff and other staff as part of this big transformation. People got nervous, scared, saying, gosh, I wonder what's going to happen. And I can tell you that has almost turned around. I think we have 64 resumes right now for nursing. I mean, we have been recruiting so much, you can't believe it. And so people are now coming back. Our volumes on the inpatient units have doubled in the last month, and services are really on the uptick. So I think we should be proud of that. The work this community has done is paying off. So thank you very, very much for your support. In terms of the transition of some of the services to our new vision providers, we anticipate transitions of pediatrics and addiction services in September, so within the next 30 to 60 days there. Finalize our sale of the Macaulay Manor to post-acute and to the dialysis service line to Fresenius. We also anticipate to happen this year. And continue working towards our affiliation with the University of Rochester Medical Center.
Then Dr. Ray Majewski spoke. He was introduced by hospital CEO Jen Sullivan, who we just heard there. Majewski talked about what he did when he first got into town.
So, in coming down here, the first question I was asking myself, well, what am I going to do? So I'm going to meet with the medical staff and talk with them. The first thing I'm going to do is just listen. Just listen to what people had to say. Listen to the providers, the nurses, the doctors, the technicians, the administrators. So what are your issues? I came and I asked every one of these people that I talked with the first question. What are the most important issues for your patients? Most of them have been taking care of patients in this facility, living in this community for decades, and know this community far better than I have or ever will. So it was interesting for me to find out what it is about taking care of patients that's important, and what do I need to know, and how can we make that continue. The second thing I wanted to do was to establish good lines of communication between the administration and the medical staff. If there's one issue that is basically a biggest problem in many of the facilities I've ever seen and worked, it's the failure of communication, one group to the other. It's the failure to bring people into the tent and understand what's going on. Not like the mayor said earlier, it's not always that people agree, but people should be able to hear each other, what we have to say, and move forward with every opportunity for what people think about. And that's what I was trying to do as well. And in the process, those two things would then create a process to restore and revive the hospital in terms of make it as great of a facility as we possibly can and to move forward. And my vision has always been to move forward, not to look at the back, what's happened before, is how can we make things moving forward the best that we can. And so basically, attaining financial stability and sustainability, well, I'm a doctor, I usually do the opposite. Doctors are not great business people. So we allow the administrative staff and others to take the lead when it comes to doing that. And so our job is to try to make the facility, the clinical care, the safety, and the quality the best it possibly can. And I can tell you that the good news is that when I talk to the medical staff, the physicians, the nurses, the technicians, everyone having to do with things, you have a great number of talented, dedicated people who want to do the same thing. And so my job is easy. My job is getting them all in the room and trying to get them all going in the same direction, but they have the same purpose in mind. So the best news you're going to hear tonight is your medical staff that's here is dedicated, is high quality, and it's moving us in the direction that we want to move to make this a great facility.
Machevsky reiterated a point that Mayor Sean Hogan had made earlier about the importance of using the hospital.
We saw the signs that said, save our hospital, and so what you're going to hear from me tonight is, don't say that again, use the hospital. Because the hospital's at a point now where the quality of care moving forward, the services that are being provided, the atmosphere, you need to take advantage of that facility when you have to. It's a great asset to have a great facility like that in your community. And so we intend to continue to make it the best we possibly can.
Dr. Machevsky spoke about an important conversation he had early on with Hornell's surgeon, Dr. Byron Collins.
The first thing I listened to was one of the physicians here at Dr. Collins. Dr. Collins, who's been here a few more years than I have, basically said that you're not going to have a viable hospital until some critical services are established so that the citizens of the city know that we can provide those services 24/7. And you know, he's absolutely correct. And we've been trying to do exactly that, restoring some critical services, and you'll hear about those, and one of those is surgery.
Dr. Machevsky went into some detail then about the surgical department at St. James.
Well, I can tell you that we have begun and will have in September a full 24/7 surgical service that will be able to do surgery at St. James Hospital, the kind of surgery that you ought to be able to do at a hospital like this, 24/7. I will tell you that we already have Dr. Pilcher providing neurosurgery consultations. A need for many of the individuals were vascular surgery. Vascular surgeons are surgeons who specialize in blood vessels, and they do many things with providing access to people with kidney disease, freeing obstructions when there's an obstruction or a clot in a blood vessel, and they do a lot of very vital things. Well, one of the chief of services of It Strong, his name is Mike Stoner, has agreed to come down here and provide those services here, and I think that'll be a great asset to many of the needs of the citizens have in this community and the surroundings.
Here's what Dr. Machevsky said about the ICU, the intensive care unit.
If nurses, there's the basis of care. For example, intensive care. People said that there had been an intensive care unit here before in the past, and how can we restore that? So what makes a bed an intensive care bed versus a bed that's a normal bed? Nurses. An intensive care bed, nurses nurse that bed 17 hours out of 24. That means when there's a patient in a bed where a nurse will be specifically for that patient 17 hours out of 24, that's an intensive care bed. However it looks, whatever it does, it's intensive care. It's all about nursing, intensive care, regular care. So recruiting experienced nurses to help provide the care and the safety to take care of patients is extremely important, and that has been the highest priority that we've provided.
This week we're playing the biggest and what we feel are the most significant parts from the town hall that St. James held at the Main Place on Main Street in Hornell. When we get back, the Q&A part, the question and answers, questions asked by Hornell 9th Ward Alderman Deputy Mayor John Buckley and North Hornell Village Mayor John Falchi, and some other questions too. Stay with us. It's Top Story on AM 1480 WLEA. Back on Top Story, I'm Brian O'Neill, and we have the town hall from St. James playing the audio from that. We posted some of this online, but not all of it. And this is the question and answer part of the forum. Mayor John Fauci here asking if the plans are definite for a medical facility to start up in North Hornell.
Thank you, Jen. With the partnership with the U of R and St. James, was there a clause in it that a new hospital would be built contingent on the partnership going through, and that new hospital would be built in the North Hornell area, the Mercy Care area?
There is a plan to build a new facility. The answer to that is yes. Part of that is the state plan I was talking about, that multi-year transformation plan. And we need to obtain funding to build that building. So really that's the next step, is to continue to secure the state support. It's a pretty expensive building, and we're going to need a lot of the dollars that have been placed aside for healthcare reform and transition for that. So the plan is, yes, to build a facility. The site we're still looking at is the one in North Hornell next to the nursing home. And the reason we're looking at that is we're trying to create a medical village where all the services we provide are on one campus. And then when you have everything on one campus, it makes it work better when you're handing off from one provider to another. How often have you gone to one type of physician and then you have to go to another type, etc.? It's easier for them to collaborate and for them to work the handoffs if we're all in one place working together.
One of the big questions that was asked that night was about maternity services coming back to St. James.
You know, last night in the paper they talked about one of the reasons that we don't have it anymore is because our census had decreased so much. But in truth, our census decreased because our moms were told, and our providers, we had 4 providers that were very willing to stay here, were told that, you know, it was not feasible because we weren't going to have inpatient beds, we were not going to have 24/7 surgery services, which are necessary for maternity. Now both of those have been restored, but still nothing's been talked about with maternity, and we're just wondering, you know, where that stands.
Well, as Jen said earlier on, first, while everybody recognizes, and it hurts not to have a service that you've had in OB, everybody recognizes that it would be nice to have those services, no question about it. Again, what I said earlier in my talk was that the most important thing for me is that we have a safe service, that we provide safe care. Most facilities, most literature that you read, you have to get into the area of providing at least 400 deliveries or more to get into that category. And so we basically would have to get into that region to be able to provide safe services. But I think earlier, to begin with, the first thing we're trying to do is first provide the kind of services to be able to get to that point as well in the future. Right now, I haven't addressed the issue of OB care. I've addressed the issue of the other things that I mentioned. And but again, in the future, that's an issue that has been recognized here in the community and should be looked at. But right now, I can't tell you that there's a plan to bring OB back right at this moment, to be very honest with you. But I can't tell you that it won't be something that could be done in the future as well.
Hornell Alderman Jim Bassage asked about the possibility of bringing mental health services back.
There's been a lot of nice things that have been talked about tonight that are coming back, and you're exploring what other services we need. But in your discussions, has there been any discussion about mental health services? We had an inpatient, adolescent, and adult psych units here for a number of years that served a great purpose. They're gone. And to the CEO's comments about the effect of services on families, that they've got to go someplace else for those services, assessments and things, I wonder if any of that may be coming back, or the discussion around those services.
Yes, there has been. In fact, I think I said earlier that on the top of the list of several people, several providers, their number one item had to do with mental health or psychiatric services. I think it's fair to say, having practiced in our region for 30, 40 years, mental health, outpatient mental health services being scarce is not unique to Hornell. And in fact, it's occurring in Rochester as well. getting good mental health services, continuity mental health services in the communities is a very difficult thing to do. And so we've had a lot of discussion in terms of how do we make this work. That's why one of the issues that we started to talk about was even using the telepsychiatry, which doesn't make the answer to everything, but at least is expanding the ability for psychiatrists and other mental health providers to come in this direction. And so this has been on the list as an important item. And important, I know, because of your past history here as well, but also important because it's one service, whereas a primary care provider, it's a very difficult service to secure for the many patients. And it's a very important service for many of our patients who we see. Many of the primary care patients that I see have significant mental health issues that need care, and not only on the outpatient areas, in the outpatient areas primarily. So the answer is yes. I wish I could give you a solution for all that we need right now, but I can tell you this is one of the things that is hot on the list, both to recruit outpatient providers in psychiatry and behavioral health that will be able to expand into the region, as well as developing other regional services. And there are many services that go far beyond just addictive services or services for the severely mentally handicapped, but the other type of services as well. So we're trying, but it's an extremely important but difficult thing to do. But the first headway is the telepsychiatry service, which is a brand new service that the university provides to do outreach at hospitals primarily or other facilities. And I say at least that's a start, and hopefully that will get the ball rolling.
And the last question that we're going to feature here in the St. James Town Hall Forum from the other night was Hornell Republican leader, Deputy Mayor, 9th Ward Alderman John Buckley talking about the funding for Oak Orchard. Buckley starts out by asking if Oak Orchard has to reapply for the grants every year.
Do they have to reapply every year for that funding?
They do not have to reapply every year, but I'm going to have Jim Cummings from Oak Orchard answer that for me. He's more familiar.
We do have to reapply, and we do that every 3 years, I believe. We'll actually be coming up for that application in 16. We're presently funded for the operation here through the end of 16. We'll make application in June, July timeframe next year, and that will be granted for 3 years.
In the event that funding in the future doesn't come to fruition, would you still make the commitment to Hornell?
Yes, I mean, we were making the commitment to Hornell before the grant came through, and with some significant efforts, as mentioned, Congressman Reed's office very helpful in getting that grant. But we were coming, and we think that there can be a viable practice here, and we're now looking at dental services, which we also do, and starting to plan for that implementation. And we think when we put it all together, we can make it go.
Hornell 9th Ward Alderman John Buckley asked a question of Jim Cummings from Oak Orchard, and that was the answer from Jim Cummings. Well, on today's show, we heard the St. James Town Hall meetings. Wanted to play the more important highlights from the meeting. Thanks for listening. I'm Brian O'Neill. ABC is next on AM 1480 WLEA Hornell.